rapid access to comprehensive oncology data and survival analysis. This is the Oncotoolkit.
Okay, you've got a patient with metastatic spinal cord compression. The decision you make in the next few hours is going to define their quality of life. And it's a real high-wire act, isn't it? A balance between aggressive surgery and palliative care. We're talking spinal mets. The risk of irreversible neurological damage is high, and the clock is absolutely ticking. So the question that's burning in your mind is this patient a candidate for that major excisional surgery, or do we need to focus on palliation? Answering that usually means digging through papers, checking multiple scoring systems, and spending hours, valuable hours, calculating prognostic scores. But what if you could take all of that work, all those hours, and just distill it down to minutes, instantly, right there at the point of care? Look, this whole clinical dilemma, it really boils down to one critical factor. You've got to accurately predict survival. That's the only way you can match the intensity of the treatment to that patient's actual prognosis. Spinal metastases, as you know, are a devastating complication. They cause incredible pain, and they are a direct threat to neurological function. So the goal of all these prognostic scores is to stratify patients. For those with a longer predicted survival, say over a year, that big invasive excisional surgery might offer the best possible long-term outcome. But for patients with a shorter life expectancy, let's say less than 6 months, the focus has to shift. The goal becomes palliative care, to maximize their quality of life without the massive burden of a major surgery. So to really get how the tool automates this, we've got to look at the science it's built on. This isn't just some random algorithm. It's founded on validated, evidence-based scoring systems that have been the bedrock of clinical practice for years. Okay, first up, and probably the one you're most familiar with, is the Revised Tokuhashi score. It's this really comprehensive 15-point system that synthesizes 6 key prognostic factors, everything from the patient's general condition to the nitty-gritty of their cancer burden. And right here, you can see what makes it so useful in practice. The score directly maps to a treatment strategy. A low score, 0 to 8, that suggests survival is less than 6 months, so you're leaning towards conservative or palliative surgery. If you're in that middle range, 9 to 11, you're looking at a prediction of at least 6 months, so palliative surgery or radiation is on the table. But a high score, 12 to 15, that indicates a predicted survival of over a year. And that is the patient who's a strong candidate for definitive excisional surgery. Now, while Tokuhashi is a big deal, it's not the only game in town. You've also got the Tomita score, which really hones in on tumor growth speed and metastatic burden. A high score there, like 8 to 10, suggests a prognosis of only around 6 months, guiding you towards supportive care. Then there's the modified Bauer score. A low score of 0 or 1 suggests survival is less than 5 months. And finally, the Linden score uses performance status and tumor type to stratify patients. A top score of 6 there could mean an 18-month survival. The point is, each one provides a unique, evidence-based lens on prognosis. All right, so now that we've got the science down, let's actually see how the app takes all of this and builds it into a super streamlined clinical workflow. So here we are. It's dead simple. You just go down the list and plug in the patient's parameters using the clinical data you already have right at your fingertips. Each of those 6 Tokuhashi factors we talked about, it's just a clean, simple drop-down menu. And boom, just like that, you get an immediate actionable result. The total score, the predicted survival category, and the evidence-based suggested strategy. It turns a complex, multifactorial assessment into a clear point-of-care decision support tool. And this is something we feel really strongly about. We just don't believe in black boxes. A clinical tool has to be transparent for you to trust it. There are no hidden algorithms here. And this is the best part. Check this out. The result is shown right there next to its foundation. You can instantly review the clinical context, the primary source citation, yep, that's the 2005 Spine publication, and the simple formula logic. You can always verify the why behind the recommendation. Okay, this is incredibly useful for a single patient. But this is where the tool really levels up. It moves beyond that one encounter and becomes a seriously powerful research engine. As you're evaluating patients, you can save each calculation with an optional de-identified patient ID. And over time, without any extra work, you're building a structured, local database of your own clinical cohort, completely ready for analysis. The workflow is just incredibly simple. 1, you calculate the score for your patient. 2, you save the result. 3, when you're ready, you export your entire cohort into a single CSV file. And 4, you begin your downstream analysis. You've just transformed your routine clinical work into a research-ready data collection process. So let's close the loop here. How do we take that raw data and seamlessly turn it into insight? Well, this is where the data flows directly into our other analysis tools. Now, we all know the first step in any robust analysis is the worst part, cleaning the data. The free CSV Polisher automates that whole tedious process. It handles missing values, it correctly formats your variables, it basically gets your data perfect for statistical modeling. Then you upload that polished CSV right into the survival analysis tool. And with a few clicks, it completely automates the generation of publication-ready Kaplan-Meier curves, it performs log-rank tests, and it calculates hazard ratios, giving you the power to analyze your own cohort's outcomes. What you have here is a complete, seamless pathway, from a point-of-care decision to a powerful research insight. So the question is, what if you could turn the clinical decisions you make every single day into your next publication effortlessly?